We're live.
We're live now. We're live.
Okay. All right. Good evening, everyone, and welcome to our Caribbean Current panel discussion on the topic preserving your mental health while on the COVID-19 quarantine or lockdown, as some people, as it's commonly referred to. And we are live with this discussion. We want to thank AI Live for facilitating this public event via the YouTube page. We decided to go live because we wanted this session to be interactive and to allow people the opportunity to ask questions, those persons who may have specific questions they want answered. And so that's why we're live. We're recording it, so hopefully you might place it on some other forum that perhaps other people, those who have missed it, might be able to catch up. We have as our panelists this evening, Dr. Banks, Dr. Linda Olwekemi Linda Banks, and we have Mr. Goboye Bamishile. Dr. Banks is a well-known public figure in Anguilla. She is a clinical psychologist and she holds a PhD in clinical psychology. She obtained that in 1986 and a master's degree also in psychology at Pennsylvania State University in the United States. She also has a first degree in clinical psychology as well. She currently works in Anguilla in her own practice called the Sunshine Lady Professional Services, and she is an associate professor of psychology at the St. James Medical School, also in Anguilla. She carries many hats, and it's a lot. So I would say that she loves poetry, she loves composing. She's a published author of her book Starfish: A Journey in Healing. She's a serving member of the Anglican Church, a lay reader, and she is the founder of the Omolulu School, Teacher Gloria Omolulu Institute, primary school in Anguilla. So Dr. Banks, welcome.
Thank you very much for that glowing welcome.
You deserve it because you're a woman, you're a well-accomplished lady, you've worked very hard, so you deserve it. And we have Miss...
For putting together this program.
Yes, thank you. Thank you very much. We have Mr. Goboye Bamishile. He's a Nigerian national, but he's employed in Montserrat. He's working for the government of Montserrat as the clinical psychologist in the Ministry of Health and Social Services. He holds a master's degree in clinical psychology, and he obtained that degree from the University of Lagos in Nigeria in 2002, and he also has a first degree in guidance counseling. He has a vast experience with working with children, adolescents, and adults, and aged who go through various forms of psychological distress and loss of functioning. He also was trained at the Ellis Institute in New York in a process of an approach called REBT. I suppose he'll explain more about what that is. And he's an excellent motivator. He's a member of the Rotary International as well as a former basketball player. Goboye Bamishile, welcome.
Thank you very much. It's a privilege to join this discussion.
Right, we had Caribbean Current. Caribbean Current started off as a chat group in 2017 after Hurricane Maria. We set it up to give information, to provide information to persons in Anguilla, St. Martin, Dominica who needed to connect with family members because we had hurricanes back to back. We had Irma in St. Martin and Anguilla and Maria in Dominica. And so the chat group survived for 3 years. And then, so it's still, after hurricane, was a hurricane in Bahamas, we revived it because it was just dormant. And so now it's very active and people are interacting with each other very heavily now because of what's happening with COVID. So we decided that we're going to provide more information to our group members and to the wider public. So that's why we put together the panel discussion to help people to overcome the challenges they may be facing emotionally and mentally. Because we know that COVID is forcing us to live basically in boxes, and our whole lives are all impacted and changing. And some people will feel the impact even more than others, because some will lose family members, some will lose their lives, some will lose jobs. So we're asking that, we're asking our psychologists to help us, give us the skills we need to cope in these really trying times. So, Dr. Banks.
But before you go any further, Miss Benjamin, you have not introduced yourself.
Oh,
We are honored to have this panel chaired by Miss Ivenia Benjamin. She's a senior magistrate here in Anguilla. She hails from Dominica, but she has a vast array of credentials, a vast amount of experience. I've been in her courtroom on many occasions, and I've always admired the way she's dealt with the cases that she is working with. So it's no surprise to me that Miss Benjamin, who tries to initiate all kinds of activities, all kinds of things which are helpful to people, it's no surprise to me that she started this chat, and that she's now moved on to take it even further, to have this interactive live broadcast this evening. Thank you very much, Miss Benjamin. You've connected many people, and you will continue to connect them through this program and many others that you do.
Thank you, Dr. Banks. And I am so not accustomed to focusing on myself that I forgot to introduce myself. So I'm sorry about that. Honestly, it's a genuine mistake, because usually I always focus on everything around me except me. So I'm sorry about that. But for those of you joining in who do not know me, my name is Ivenia Benjamin. I am from Dominica, as Dr. Banks said, but I work in Anguilla. And I connect with everybody all over the world, because on Caribbean Current, we have members from all over the world, and we try to let people know that there's somebody on the chat who can assist you if you need something. So we remain connected, and we will keep each other informed. So back to the subject at hand.
Such a fantastic lady with noble ideas all the time.
Just honestly trying to do what I think God is asking me to do, and that's all there is to it, really, So, Dr. Banks and Mr. Bamishile, what would you say to people who, some people have been on lockdown for 2 weeks already, and we hear a lot of complaints that people say they're so bored, start moving all they do is move from the kitchen to the bathroom to the living room, and that is it. Some people, that's it. What would you say to people who the monotony is setting in and people are beginning to feel like, I'm losing my mind?
Well, let me try to start so that Doc will always wrap up as a senior colleague. Generally, our experience across the globe today will generate some anxiety, some concern, some fear, and these are normal reactions to what we have in terms of COVID-19. Of course, about a month and a half ago, when we started having the increased heightened level of this disease, no one thought it would get to this point. But as we were today across the globe, we'll have a lot of panicking, graduated from just normal concern to intense anxiety, depression, and so forth and so on. Some will even resort into alcoholism and the use of psychoactive substances. Now that we have most countries on lockdown, before lockdown, we've had an issue of isolation, self-quarantine, and social distancing. But the heightened now is that the fact that we have lockdowns mostly around most countries. So one would expect that it has a huge toll on mental health for every individual. And I'm sure that is one of the major reasons why we have to have this discussion among ourselves.
I'm not hearing you very clearly, Mr. Healy.
Can you hear me?
No, there's
I can
someone
hear
else.
you,
You can
but
hear me.
speak close. Go pick up your microphone.
Am I audible enough, or Dr.
It's
Banks
it's
not?
It's
it's
better
better.
now.
Dr. Banks seems not to hear me at all. I
It's
can
I can
better
see.
now.
hear you, but I was understanding you clearly.
Okay, okay. You didn't get me clearly.
No.
Yeah, I was just saying that we expected some normal reactions in terms of fear, anxiety,
Okay.
concern generally. But as time went by, we begin to witness an heightened level of the spread of this disease. And that has generated a lot of complicated psychological issues like chronic anxiety, depression. Some families or individuals have resorted into the use of alcohol and psychoactive substances to beginning to cope. And I'm sure that is the major reason why we have to look at the implication globally. And of course, as a clinician, try to help general population on how to cope with this current situation we have currently.
Yes,
It's
I
not just
agree that people will have all kinds of reactions because this is something that's totally unexpected. It's totally unprecedented. And when anything new happens in our life, we have to get accustomed to, we have to adjust to it. And there is no adjusting to this because every day it seems like there's something new happening. So when we have lots of changes, it is very stressful for us and it's very difficult for us to adjust. So we have to, at this time, be aware that others around us are also trying to adjust, trying to make life work for them. And when we are in a very cramped environment like we are in, when we are asked to stay home, there'll be conflicts, there'll be interpersonal conflicts, there'll be frustrations. There will also be grief reactions because we are now losing what we've been accustomed to having, what we've taken for
Exactly.
granted. So, we normally associate grief with a death. And of course, there are deaths, but I'm not talking about that kind of death at this time. I'm talking about the losses that we have, the loss of freedom, the loss of the ability to jump in our car and go where we want to go, the loss of the ability to go out with friends, to go out for
Mhm.
dinner, to go to the beach, with company, because we have to practice social distancing. So people will have several grief reactions, both adults, the elderly, and our children. And I guess as we go on with the program, we will talk more about how we can help those different groupings cope. Because there will be conflict, we will get aggravated, we will get irritated. Because once you feel kind of penned in, once you feel kind of trapped, you kind
Mhm.
of strike out unless you're
but
aware that these are reactions that we will have and you learn to cope with them.
but in Anguilla, for example, people allow well, supermarkets are still open. And I'm certain in all countries, supermarkets are still open. So there's a limited time that you can perhaps, you have to make it to the supermarket and back. But in
Mhm.
Anguilla, we're allowed to exercise out in public for 90 minutes. So that to some extent should, if people are aware of that, ease up the tension of being housebound. But my concern is with elderly persons who perhaps live alone and relied on family members to visit, perhaps to bring a meal or something and spend time. But because they are in such a vulnerable group, and this is such a threat to the elderly, many people will not have the companionship that they would have from relatives visiting. So, what would you say to people like the elderly people who now have to learn to spend a lot more time alone?
And because we know that the elderly are in the vulnerable group, we are
Exactly.
very reluctant to visit them too when they need us most. So I know Mr. Bamishili was about to say something. So continue,
Exactly.
Mr. Bamishili, and then I'll interject after that.
It's okay. I was just to pick it up from there that fine, we all know that the elderly are at high risk of severe symptoms and even death. as regards this virus concern. Definitely, we have most of our aged people in the nursing homes, in the assisted residential apartments, or even their private homes. But as it is now, beyond the issue of social distancing, we have to ensure that our elderly are protected. And the issue of isolation and loneliness are very critical to the aged people at this point in time. And we need to do a lot to ensure that, well, there might be some isolation because of their vulnerability, because that is objective. But there can be a way where isolation does not necessarily lead to loneliness. That's one thing we have to do as clinical psychologists and encourage our people. How do we encourage our aged people, even though they are in isolation because of their vulnerability? How do we encourage our people not to make them to be lonely? Because loneliness will not be the subjective feeling of being lonely. So there's quite a lot we can do through the social media. We can encourage family members to connect with the elderly through telephone, through social medias, even writing letters to them, postcards, and stuff like that. We can encourage some generational connection. The younger ones, the grandchildren, should be encouraged to check on the elderly to start with, to protect, because we have the duty bound to protect them. If we don't protect them, they are either, exposed to this virus, and severe symptoms and death will come. And by so doing, they can even pass it to the younger ones. So it's a cycle. And that is just the main reason why the elderly are seen as the vulnerable group. And of course, we have to do a lot to protect them. So the issue of loneliness is very critical to them when they're in isolation. And that we must be able to safeguard to ensure that we connect with them as much as possible.
Glad you mentioned social media because, many of our elderly, thanks be to God, are now connected to WhatsApp.
Yeah.
And so that's one way of getting out of their little space because, I tend to forget the days, because one day, although I'm still working very actively, one day still seems to roll into another. And I understand that many elderly persons are complaining about memory.
Yeah.
Forgetting what day it is, forgetting what's, so it's very important for us all, including the elderly, to have established routines. And we need to take care of our bodies. We need to have a routine of, maintain the routines we would have had before about what time we go to bed, what time we get up, what time we eat, when we have meals. Maintain the usual routines of bathing at an appropriate time. Get some rest in the day if we need to, and also get some exercise. Take a stroll. We are still able to stroll in our yard area, and as Ms. Benjamin said, we are still able to exercise. I know that the gyms are not the places where people can exercise anymore, but you can still exercise in your particular area, walking around the block. At least in Angola, we're able to do that, and that's a big plus. Because if we don't get, and that's sunshine, if you don't get that sunlight, there's something in psychology called SADS. Happens to people in the winter when they don't see the sun. We in the Caribbean have an abundance of sunshine, but when we are feeling a bit depressed and feeling as if we are being restricted, we forget that we have that natural element out there, which is very critical for our bodies. So even, going outside under a tree, we have many trees in the Caribbean, or if you don't have a tree, go on your porch and get that sunshine, that light into your life. And then give yourself a different perspective, of rather than just looking at the four walls.
But we also have people who suffer from anxiety because of serious concerns. Some people will lose, as I said earlier on, their jobs. A lot of people in the private sector have been sent home and asked to stay home, and they don't know what's going to happen. They relied on a weekly wage, and now they don't know if they can pay the rent coming for the next couple months. They don't know what's going to happen. And you have single parents with children to feed, and that is a big concern for a lot of people, and a lot of people are anxious because of that. So it's not just, and then to still be at home sedentary, just watching, the time go by. For some people, it really is distressing, and One person in our group chat actually posted a message earlier on in the week that says, watch your mental health. Somebody in my country, because that person is in the Bahamas, somebody committed suicide in my country this today or this morning. So people may not always say what is bothering them, but with what is happening now, this COVID is having very serious economic consequences for a lot of people, and and that is a great source of anxiety.
And
Exactly.
and anxiety begins in our mind. It is what we say to ourselves. And there's a cycle, you know. We perceive a situation, we make an interpretation, and that interpretation creates certain emotions, which kind of creates certain actions. So, one of the things we can control is our mind. And I came across something which talked about mindset shift during a pandemic, which I thought was very important, very good. We might say, I'm stuck at home. Rather than saying that, we can say, I get to be safe in my home and spend time with my family. We see all the media stories, so we might be saying, I will get sick. So, what can we say to contradict that? I will self isolate and wash my hands. This significantly decrease my chances of getting sick. You might say, I will run out of items at home during self isolation. Well, we can remind ourselves, I have prepared for this and I will use my items wisely. I have everything I need for now. You might say, everything is shutting down, I'm panicking. Remember, the most important places, the medical centers, the pharmacies, and the groceries are still open. And then, of course, there's all that uncertainty about what, you know, we look around the world and we see what has happened in other countries. So we might say, what's going to happen to us? We are so uncertain. Well, we can remind ourselves, while I can control the situation around me, I can control my actions. I can call loved ones. I can get enough sleep and proper nutrition. I can pray. I can read my Bible. I can do activities I love at home. I was speaking to someone today and she said she's in her garden. You know, we can do natural exercises like breathing in and out, you know, breathing in and out slowly and
But
just giving
but
ourselves a chance because anxiety is incompatible with relaxation. So if
that
we
is
try
true. But if you have
that,
people,
will help us to relax
when
and change our thoughts. Yes, Miss Benjamin, you were saying.
I was saying that when people are accustomed to hustling, you out all day, every day, sometimes you're out for long hours, working, trying to make ends meet, and
Yeah.
suddenly your pace has slowed down. And
Mhm.
then there's that threat now of you losing your income. Then the other thing is that you home 24/7 and everybody's home. So you might have an overcrowding situation going on as well. And perhaps there are people who are not even accustomed to stopping to even meditate on anything. So now they are forced to think. And most people would probably just think negative. They probably wouldn't even think, let me think,
Sure.
let me.
Yeah.
So in
Sure.
terms of, yeah, so in terms of how do you like, what do families do? How should families, because family members have to be there for each other now and understand what each other is going through to be able to help them because people don't usually always say, as I said, what's on their mind. So
I think Dr. Bang is trying to roll out the range of coping strategies for such situations. But starting with what she said, to back up the issue of mindset, I know people are going to lose a lot of money, a lot of profit. Like you just said in the prologue, a lot of people depend on weekly wage, some by monthly wage and stuff like that. And so many businesses have closed down around this period. Definitely, one thing to back up the mindset in terms of positive thinking that Dr. Ban is trying to tell us the other time is the bringing out the altruistic reasons for staying active is very important. That will help business who are closed, people who have lost profit, people who are not making money to cope to a certain extent. The altruistic reason is because, look, you have to help yourself and help others. So many people can be protected from contracting these diseases. And for your sake, you are staying home, you will have a part in protecting your neighbor and protecting yourself. So the artistic reasons for staying home should be made known by family members to the general population. That in turn would actually reduce to a certain level the heightened anxiety Ivenia is talking about. There are quite a few other things that they can do to cope. This is the time they should speak to beyond family members, seek counseling, because I can understand the toll of economic loss. The mindset will not definitely be automatically positive. It has to be negative. And like you said, somebody committed suicide lately. We still have a lot of implications even after the COVID-19. And so much effort is being put on resuscitating people from dying, making sure they recover from the medical conditions. But we're all going to have a lot of mental health issue on our hands, even post-COVID. And that is one thing we have to prepare for. So for us to be able to have a mild impact, everybody needs to cope. Everybody needs to speak beyond coping, family members to counselors. This is the time people like Dr. Banks and I and other colleagues across the globe have a lot of work to do. Daily interaction with counselors, getting counseling, talking about coping, changing mindset from negative to positive will actually be the in thing around this period. Because we cannot just fold our arms and allow them to cope automatically. It's not easy to cope in such situation.
Now, children, you have children.
Get to that as well. Go ahead.
Now they've been away from school in Anguilla for example, for the last 2 weeks. They've been away from school, and some of them are having like online classes. How do you explain to a parent what they should say to a child as to when this permanent, is this going to be permanent, or when is this homeschooling thing going to end, because they want to go to school, they want to meet their friends, they want to get back to their activities?
It's very
earlier on. Okay, earlier on when you were talking about the age group, when you got to children, you noticed that Dr. Ban and I kept laughing, and the reason is not perfect. If I could preempt her, children.
Go to your mic.
Coping with children is coming with additional responsibility, and that again can be another source of stress to the parents, because children, we all know, are very active. When we talk about routine, they are used to having routine. They are energetic. They are very high level of functioning. So now that there is restriction, they are at home. The stressors and problems that the adults will have to combat with are heightened because of the presence of children around them. They have a lot. Imagine you have to think of what to give them, how they start eating. Okay, like I was talking to somebody that when the lockdown news is coming, people started buying things, and I take that to be panic buying. And I said to her, look, make sure as you are doing panic buying, please make sure the children don't do panic eating, because now, being at home fully, you can be rest assured that eating will just be every 30, 40 minutes. That alone can have a toll on the financial strain of the parents. Then to keep children within activities can be difficult sometimes. That's why we have to give kudos to what our teachers are doing in various schools. Now the parents who are not at work will now be at home, begin to put them in a planned activity, because they are very active population. We must plan the activities beyond educational or schoolwork to extracurricular. There must be time for them to go on their schoolwork. There must be a planned routine in terms of activities within the remote area, even with these restrictions. Otherwise, after getting on their educational setting for hours, and of course, we also note that the threshold for tolerance, the threshold for concentration is not as high as adults. So in matter of 1 hour to 2 hours, they are in their educational school, they tend to get tired. Okay, what next? And of course, they still have about 12 to 14 hours to get to bed every day. So we have to plan more activities for them in terms of recreation, in terms of other things within the home. You can set them on other assignments in terms of skills learning. learning, teaching out them how to make things, how to sew clothes, how to read that, especially the advanced adolescent stage. So it's very important. Then children who are also very special. We have some special children now who at this time would have to be at home with their parents. I want to encourage such parents to liaise with the special educator to be able to assist such parents in dealing with the children who are home with them now. Because we all know that these children have diverse needs. Okay? Diverse needs. Currently, you have children who are autistic, who have this or that the teachers have been coping with in school before. Now the full responsibility of these parents to deal with such people at home. So
But
it's a total.
I'm sorry for interrupting. No, carry on with what you were saying. Carry on.
Okay, so it's a toll on its own. I'm just trying to say that it's an additional responsibility, additional burden to the parents, and it's also an additional source of pressure. So parents would have to be able to plan activities, and in need, when they feel they need more hands, they can contact through telephone the special educators who can help them out, and also talk to the child psychologist to help them plan the day for the students.
I must say that the teachers here in Angola have been doing an excellent job. They are providing the children with online activities to do online work. In fact, I spoke to some children from the high school, the secondary school, and they were saying, I wish I was in school still. There is so much work in school. I do science from this time for that hour, but now my teacher is sending me so much work, and so for some of them it's an overload, and which means also that the teachers themselves have a lot of work to do. It's not easy teaching all these children online. And then for the parents too, there's a role change. There's a change of role. Some of the parents will not be familiar with the work that the children were doing, and so they are challenged with assisting them. And one grandmother told me that her granddaughter said, Granny, I don't want you to be my teacher. I want you to be my granny again. So there are these changes of roles which our children have to get accustomed to. Some of them will become, they're anxious. They might not verbalize their anxiety, but they will exhibit their anxiety in the way they react to us, in the way they confront parents, in the way they challenge things. And it will also, in some cases, lead to some regression in terms of their toilet training, for the younger children. And then as Caribbean parents, we have a way of saying to our children, you are rude, you are disgusting. Please, please, please refrain from saying that to your children. They are not rude and disgusting. They are grieving just like you. They are scared just like you. They are worried, they are anxious, and they have even less control than you do. So it's very important for us to tell them what's going on, keep them abreast with the news, explain it in ways in which they can understand. Inevitably, for some of our children, some of their family members will be infected. They will need to understand what's going on there. They will need to be prepared for whatever happens. They would normally have been accustomed to communicating with the family member if they were away from home in the hospital. Now, this is not possible in this present situation. Mm-hmm. So it's very important for parents to involve children in the conversations. As Mr. Bamishili said, get them involved in activities. This is family time. This is time for us to do a whole lot of stuff with our children. One mother of a client of mine was saying how her client was teaching them dances. She was teaching them tap dance, And the client said to me, because I'm seeing my clients online still, through WhatsApp video. And she was saying to me, oh, it's so good. We now have more family time. So children are now getting an opportunity to interact with their family. Teach them some of those old Caribbean games, those old games that we knew, Spend time with them and let them know that, yes, this is a tough time for all of us. None of us expected this. None of us planned for this, but we'll get through this by the grace of God.
But with adults, with married couples, married people, I saw a news item on American television, and they were saying that after COVID-19 quarantine is over, they can expect the divorce rate to soar because married couples spending so much time with each other, and there's the work routine is broken for some people. They can't go to work. Others have to work from home. And even if they can't walk for 90 minutes, but they can't go to the bar to line with their friends and whatever else they do in the evening. So they have to spend that time at home, and they're going to get on each other's nerves. So they actually did say that the divorce rate will rise, which I don't like to talk about because I don't like that for married couples. You want them to
Well,
stay
it's
together.
important that you say that so that the married couples and those who are couples married or not married will realize that this is a time of increasing tension. In fact, today my lecture online for my medical students was on sexuality, and I talked about how sexuality when there's anxiety, it affects your sexuality. It affects your, especially for men. There might be erectile problems. And also people talk about there'll be a lot of babies after in 9 months from now. However, um, the stress can create problems in sexuality. As you said, people don't have time apart. People feel as if that they have to be with each other rather than choosing to be with each other, and that can create stresses on the relationship. So it's important for people to be aware of that and to know that it's normal. I think that's what we need to stress, that the stresses are normal. When people are more prepared for the fact that this is going to happen, then they're better able to cope with it.
Just
And
important.
yes.
It's just important for the couple to be aware and be guarded that these are normal reactions, and they shouldn't just take it to the extreme situation in such a way that it will lead to some bigger problems.
Now, the issue of information overload. There
That's a
is
big one. That's a big one.
so much out there, and the World Health Organization actually set up a WhatsApp account that they've sent out to people and say to them, if you need information, that is what, add this number to your phone and get
Go to the
information
credible sources, the credible
credible
sources.
sources. Because you have people out there just they like to give out the worst of everything.
Mm-hmm.
That's why on Current and Current, we do not want people to post just indiscriminately. You have to filter the information that you're getting and what you're passing on to other people. And that information
Yeah.
is a source of anxiety for a lot of people.
And children too. Oh gosh, children will have nightmares. I mean, I found that I was having bad dreams, you know, because we tend to watch too much TV. And so I had to monitor myself. I had to rein myself in. But there's that kind of seductive pull to putting on the TV and keeping up with the news, to keep up with your WhatsApp. So we have to be aware that there's that inclination, especially when you're uncertain. You want to hear what's going on. You want to be on top of it. And so we have to be aware of not overloading ourselves. And definitely, before we go to bed, usually people use the TV as their before their sleep routine, part of their sleep routine. You should refrain from watching TV at least an hour to half an hour before you go to sleep.
I think it's important to really emphasize that people should balance the sort of information. Even when you get information from the credible sources, like we're talking about overloading, when you have too much of news coming to you from credible sources about COVID-19, it can actually lead to increased anxiety. So what we'll encourage individuals to do is to balance the sort of information, spend some time with the credible sources, at the same time trying to spread their time on some other things that they can learn, social skills, new things, development, self-improvement exercises and things like that, rather than concentrating 24 hours on accessing news, even from the credible sources. At the end of the day, like Dr. Linda said, when it's time to go to bed, you start having those dreams, flashbacks of the news of death, number of deaths as we speak now, and I'm sure America will be going upward of about 5,000 deaths. That's scary. I mean, child hears that before he goes to bed. That's a lot of information, even though credible, but how it's told on flashback of such children. So we have to be able to guide the way we access our information to balance it and spare time some other things benefiting to us.
But you also have, I'd like to pause here to say to our listeners that if you have any questions, you can post the questions on the live chat on YouTube, or you can, those of you who are on the Caribbean Current chat, you can actually post it there and I'll direct the questions to the panelists. Now, we also have on the issue of information overload. There are people who do not know the difference between fake news and genuine information. And all they know is that, oh, I heard it on the internet, or I read it on the internet, so it's good news. Oh, it's true. Sorry, I heard it on the internet, so I read it on the internet, so it's true. I've actually heard people say that. They tell you the most ridiculous things, and then they say to you, when you say, but that doesn't sound right, they say, but I read it on the internet. Some people think the internet is a place where everything is true. You know, so and that is fueling a lot of anxiety when the information is terrible and wrong. And now, I also met someone who told me the other day that they have relatives abroad in New York and they couldn't find some of the relatives. They couldn't connect. They've been trying to find a few of them on the phone and couldn't find them.
That's hard.
Yes, they told me, the person told me, so they don't know, they can't account for some of their family members.
So this is now a time also to try to connect. I've been getting emails from relatives I haven't seen for a long time, you know, so try to connect, and maybe you might not be able to connect to that person directly, but try to find a way to connect with them the best you can, you know. It is sad because right now there are so many people who are in hospital or who are sick that it will be not possible to find some of them. And so that's a reality. That's a new reality that we have to deal with, you know, and valuing the family that you have around you right now is very important. And part of that whole time when you're in those cramped environments, this is a time to learn to forgive and forget. Whatever gripes that you had with a family member, take some time to forgive. Take some time to forget. Take some time to after hurricanes, we always talk about how we enjoyed having, you know, to deal with just lamplight and play games outside. This is an extended hurricane period, of course, and we can't play outside in the same way. But try to be creative to find things to do with the family that you have. Treasure the family that you have. Because the worst thing is to have a family member die, and you say, I wish, if only I had. This is a time now to, more than ever, to realize that all we have is right now. It puts us in position of vulnerability and helps us to appreciate the moments that we have together.
What I did, I put together a group chat for all family members. So we check in with each other, we know what's happening. But for the people who, that could be something that family members can do as well. For those who are scattered all over the world, you may want to have a central place where everybody can connect and see what's happening with one another. Yes.
So you might not be able to connect with a particular family member, but maybe somebody else in that chat can connect with them.
Right.
Because through this chat, I met many people I hadn't, met for a lot of years. So, so who knows what can come out of that? Yeah.
Well, yeah, Caribbean Current, we want people to be connected to each other. There's a time when a lot of information was flowing through, but it has slowed down now, so people can learn who is who and who you can reach out to if you need information. Now in Anguilla and a lot of the islands, they've set up a hotline for persons who may be feeling lonely or suicidal, or they need help emotionally. And perhaps some people may feel, oh, I don't want to call the line because they might feel I am sick, or they feel like, they may feel that calling the line signifies that they probably in danger. What would you say to people about using the services that the support services that are available to help in these crucial times?
You know, I let Mr. Bamishili talk because I was talking
Yes,
quite a bit just now. Go ahead, Mr.
The
Bamishili.
other thing I want to add as well is the issue of in some countries they now have to provide food for people, relief
exactly,
packages. And some
exactly.
people may feel, boy, I not, that make me feel like I'm on welfare. I don't,
Mm,
because perhaps, during hurricane season, a family member may send something across to you and it may prevent you from having to go to the welfare. But now the entire world is in the same situation. So don't expect a package from anybody else. So,
Exactly. We cannot undermine the importance of support from government as a palliative measure. That again has a lot of benefits in terms of reducing the issue of depression, anxiety, and the fallout of COVID-19. As we speak now, I know there are quite a few countries who are doing some things in terms of palliating. In Montserrat, the Honorable Premier had a press release today, and we started by reducing taxation for people that are working. And of course, the safety services are also on top of the game by making provisions for certain vulnerable groups.
mhm,
The effect of disaster or pandemic like COVID-19 cannot just be quantified when it is over. As we speak, there are quite a lot of people, like you have said, who don't even have jobs, let alone those who are working, who are not earning salary, okay?
mhm.
And who are struggling to go out to get one or two things to do to earn a living, but now we have to be at home with a lockdown. So we would expect that government should palliate as much as possible. I'm aware of some countries that they are trying to distribute consumables, food, and some other essential activity, food to people of such countries. That's a very good idea. I think it will go a long way in reducing the psychological effect at the end of the day. Okay. At the same time, we have to keep be our keeper. Government cannot do everything. We have among the population those who are privileged to have certain things economically. They can also lend to their neighbors, those who will feel they are not as privileged as they are in terms of dashing things out. You have so much research in your house, you can give to your neighbor. You have so much toiletries, you can give some out to neighbors. Not necessarily minding, oh, when are we going to end this COVID-19? Because I know a lot of people have got a lot of stock at home because they are able to afford it. They are having stock, overstock on what they cannot use. So you see some of these things on the social media, but the information or the encouragement is that they should please be their brother's keeper. Let's back things out. Let's give some people who are less privileged, who are not as privileged as we are. And by doing so, we have done a lot in using the effect after the COVID-19. So the government cannot do anything. The government is doing their kudos to government for doing what they are doing.
And that's an excellent point, because one of the ways of dealing with depression and anxiety is to take the focus off ourselves, because when we're anxious and depressed, we get very focusing on our internal feelings, and that
Yeah.
exacerbates the bad feelings. So it's important at this time to reach out to others and serve, do something for them. Maybe, as you said, if you have too much of something, share it with a neighbor. Share it with a poor a person who's less fortunate in your community. Service is an
but
important way to help to lift depression, because when we focus on the depression, it gets even worse. But when we turn our focus externally, we relieve the depression. You
but
were saying something?
unfortunately, we are hoarding. See people hoarding because people not sure when we're going to get out of lockdown. Some people not sure when they're going to get into work. So they may have purchased things in bulk to try to
Hmm.
cover up, for the month. You
And
have
that's
children,
understandable too.
you have
And
children at home who eat more than normal because they're home all the time.
mhm.
So people, yes.
You
So
see,
maybe,
we have to emphasize that every death we're seeing today will not be 100% as a result of COVID-19 symptoms. There are some people that will be dying of hunger as we speak. Some people who will be dying of hunger as we speak. So it is important that the privileged ones among us should be able to share to prevent unnecessary death, not due to COVID-19 symptoms, but due to hunger and not having anything to eat. It's very important. Yes, it's true. God has given some people the enablement to acquire what they've acquired. But then the issue is that we must encourage individuals to be aware of keepers, to be able to share among those less privileged ones.
And it's very important that we listen to the information that's being shared in terms of the healthy practices, because I am accustomed to putting my hand in my face, and I'm finding myself being very conscious of not touching my face. Even during this program, I found myself, with the inclination to touch my face. So I think that we are developing some excellent habits through this pandemic, washing our hands more frequently, being there for others around us, refocusing our energies, forgiving, serving, being with family and friends. And as Ms. Benjamin said, there is a government in Anguilla. There is a website called beatcovid.ai, and there are numbers to call here. And on that website too, there are psychological programs that the Ministry of Health has put on. And I'm sure that every island
Yeah,
has a website, because I know
exactly.
my daughter, who's also a clinical psychologist, has been in constant contact through her department with World Health Organization. They have ongoing teleconferences and consultations. And so in every island, there are these websites which have been set up. And I advise people to get into them, tune into them, sign in,
Some
log
authentic
in, and
sources, the
call the
authentic
sites,
sources.
call the numbers that are given, because everyone needs someone.
Definitely.
And there might be someone right there who might say something. Someone, when you call in and just to talk to somebody, they might tell you something that you just need to hear at that moment. Tune into the programs, the recorded programs that are on those sites as well, the counseling programs that are on those sites. They might give you the word of comfort that you need, or the word of advice that you need at that particular point in time. So don't closet yourself, don't prevent yourself from reaching out, don't barricade yourself. Yes, COVID has us locked down, a terrible term, but that's what it is. But don't let that lockdown sensation lock you from reaching out and
No.
expanding your horizons to get help.
We also want to remind our listeners that you can post your questions on the live chat on YouTube or on the Caribbean Current chat group. Our discussion is for an hour, so we're about to wrap up. So those of you who have questions, please post them so we can have a response from our experts here. The other question I wanted, the other thing I want us to focus on is how important it is not to get infected. Earlier in the pandemic, when it started, and when it hit Europe and the deaths started to happen in Italy in large numbers, one of the things people were saying is that a lot of the older people were dying, and they were dying alone. So grandparents were, well, once you entered the ward, because it's so contagious, you're not allowed, family members were not allowed to go in there. And so people are dying alone, and that is another thing, that if a family member becomes infected, this stress of knowing that you cannot go into the ward. And if the person takes a turn for the worse, there's nothing you can do about it. Right? It's so important not to get exposed to this virus. So how do we prepare people? What do we say to people to prepare themselves mentally? We don't want anybody to get into that situation at all. We're hoping that nobody in the Caribbean will have to face that. But
And I also want to exhort people, if you have any symptoms, don't hesitate. Because what I understand is that some people have symptoms, and we have this kind of fear to have our concerns validated. So rather than going to a doctor, if we have any symptoms, someone might kind of just hope for the best and not go to the doctor. Whereas if you had faced your fear and gone to the doctor, because what I understand is that many people have mild symptoms which can be, cured. So maybe if you had taken that step early enough after you felt the symptoms, you could also be cured. I could also be cured. We could all be cured, and we can reduce the spread. Because even if you don't have the disease very evidently, you are still infectious. So once you have symptoms, you need to check with the doctor and get the help that you need. Don't let fear paralyze you. We get
particularly
paralyzed by fear.
particularly if a person has an underlying condition. It's important that you take precaution and start as early as possible to seek some kind of treatment. And because what we want to do is to avoid the hospitals becoming overrun. Because if that is the case, we have a limited number of respirators,
Hmm.
and we have a limited number of beds in the hospital. So we do not want the case in a small place like Anguilla to be overrun with patients, because in Europe, what they've been forced to do is to choose who's going to live and who's going to die by simply giving attention or paying attention to the younger people who are more viable, and unfortunately just leave the elderly to pass.
Hmm.
So
I think I like to add and emphasize on a gap. Some people have symptoms, but it's not all the symptoms that would necessarily lead to COVID-19. That doesn't mean you have acquired the virus, but it's
Hmm.
important that if you're having symptoms that is flu-like, you please
Hmm.
report at the hospital. The reason is not
Hmm.
factors, because in case you now have the virus and you don't know that you have the virus, you stand a risk of passing it to someone else, even among the family members, even with the description. So it's important the moment you are having like symptoms, even just normal sneezing or coughing, don't
Hmm.
think you have to keep under the carpet. Please present at the hospital. Let the doctor have some tests on you. It can come either way. Either you have the virus or you don't have the virus. If you don't have the virus, good enough, you go back home and treat yourself. But you have the virus, there are other steps to be taken. One, you need to immediately go on self-isolation in such a way that you won't have to infect
Yeah.
other members of the family or the other members of the group. It's important. I think what the example you are giving is happening because in most cases, we have a lot of people who are living with the virus, and when they don't know they have the virus, they started mingling with other members of the community, and the spread is going in a very geometric way, very fast. Okay? But the moment you have symptoms, don't even hesitate to go to the hospital for a test. That so then you'll be able to know whether you can return home and mingle with your people or you go to self-isolation straight away. Okay?
And people need to remember too, it's important to remember that the COVID-19 virus is similar to a flu, So you will have symptoms of a flu. I was reading, in one of the lighter moments in one of the WhatsApp, some woman was saying she's afraid to sneeze,
Mhm.
because people around her will run,
Exactly.
So if we will have symptoms of this is flu season. So don't think that everything is COVID-19. However, if you are concerned, call the hotline, and you don't have to go to a doctor. Call the hotline. They have a team who will analyze the symptoms and will maybe ease your concerns, rather than, ruminating on it and kind of worrying and worrying and worrying, putting yourself in a tizzy worrying. Maybe it's just a flu you have, but let the professionals give you that diagnosis.
but somebody is sending or making a comment that people may not feel well, they may have flu-like symptoms, but because they're afraid of being taken away from their
Hmm.
homes, they're not going to go near the hospital.
That's why
Because
they can call the hotline. They can call the hotline, and the hotline will give them an indication of whether the symptoms point to COVID-19. And you don't have to go. Sometimes your symptoms are mild, and you can self isolate at home because it's just the flu. But it's important that if you have any symptoms at all, that you consult.
You must make a call, you must be tested, so that you don't pass the infection to some other people within the family. It's important.
Somebody's asking a question about the issue of domestic violence arising among family members who are forced to spend so much time together. She's saying that the Gender Affairs Unit has been advertising a lot about of preventing abuse. And I think now they have heightened the campaign because of the domestic nature of this illness. It forces everybody to be housebound. So if you already have a volatile relationship, you already have a situation where things not working out, every minute is some kind of abuse, and now it's going to be exacerbated because of that situation. So they're saying, she's asking, how would a person cope, you know?
Well, again, awareness is important. Awareness for both men and women.
Because the courts have
that
suspended.
this is one of the possibilities.
We have suspended all court hearings, So no domestic violence matters can be heard now.
So it's important for people to be aware that this is one of the things which can be aggravated by the situation, So in terms of relating to each other, let's try not to create conflict. Let's be more gracious towards each other at this time. Let's be more forgiving. I know in Angola we're fortunate in that a lot of the men are working on construction projects, so that alleviates the family burden in some way. I do hope, however, that the men are taking their earnings home. Well, the rum shops, as we call them here, are not open, so they can't go to the rum shops to spend their money. However, I'm hoping that they're taking some of that money home to their families because the women are not really working. So yes, domestic violence is something that we have to expect will increase, and that's why awareness again. The potential for domestic violence increasing is there, and so the awareness is important.
Well, I like the fact that Dr. Barnes is talking about awareness. Beyond the awareness, I also know that getting spouses, getting partners to get prepared for what is lying ahead will also make them to raise up. I know that quite a few reasons why we're having domestic violence. We're talking about the financial incapability the other time. We're talking about having constraints financially. That alone can trigger domestic violence. Even child abuse at home, when you have limited resources and you have 3, 4 children and they are eating regularly, repeatedly, and you are getting frustrated, it can lead to some kind of abuse for the children as well. But having information, getting this planning ahead, prepare for what is lying ahead, and try to cope as every day comes by will actually help prevent some of these cases of domestic violence and abuse. There isn't anything physically that can be done now. We cannot separate husband and wife. We cannot separate partners. More so that there is partial lockdown or total lockdown. Okay?
Because the prisons are, in some countries, they are granting early release to some prisoners to avoid the spread of COVID in confined spaces among persons who are confined. And I'm certain when in nursing homes where you have elderly together, you have to keep people away from them. So there isn't, no shelter is going to take you in now because of that. So people must learn to cope. But unfortunately, it will happen.
You just have to deal with it at that situation. You just have to continue to deal with that situation and again understand each other. Try to assess the sources of that violence, what is creating aggression, what is creating anger. Once they're able to have a realistic assessment of it and they don't catastrophize it, because in most cases, why you have that domestic violence is that one or either party or would catastrophize or maximize the source of stressor. And with that, you see an outburst of anger. So having information, ensuring that you don't catastrophize or maximize the source of stressors is also very important. That will engender coping as well, managing the issues that may arise. But definitely there will be issues. There will be issues.
And it's also important at this time, for people to find time to be alone. Yes, you're with your partner, you're with your family, but it's still important for each family member to find a moment of stillness, a moment to be alone, a moment to be away maybe under a tree in the yard, maybe on a section of the porch. But discuss that with the family that I need some time out. And you need some time out. We need some time away from each other just to kind of regroup. That's very important because when you're living in cramped circumstances, tempers flare, and one thing can lead to another, and all of that. Mm-hmm.
Well, perhaps people can learn to keep a journal because that is how Anne Frank wrote her diary when they were forced to live in the attic of a building for 2 years during the Nazi persecution in the Netherlands. And so she wrote, her escape was writing a diary because physically, like 2 or 3 families lived together in one space. And they had a routine, who would cook, who would clean. But to get away, her getaway space was to spend a time, her moment every day in her corner writing her diary. That became
And
a bestseller.
Miss Benjamin, there might be more books for you to publish after this.
Well,
That's my publisher,
yeah.
folks. Benjamin is an astute lady. She knows how to meet the needs of people. I needed a publisher, and she was right there, and she served the needs of many people in the Caribbean and further
That's
afield in
right.
Africa
That's
in
right.
that
That's
way.
right. Yeah, that's right. But yeah, so we really want to encourage people to indulge in your gifts, whatever it is they are, whether it's writing, whether it's learning a language, whether it is music, whether it
Hmm.
is even working
Um,
on your weight
mhm.
fitness. You have the
And
time.
we've seen some very creative expressions on the media, haven't we? On the social
Yeah.
media, a lot of creativity has come out of this
Yeah.
virus.
Yeah, so I think it's a great time to learn things that you want to learn and to do the things you want.
Hmm.
There are a lot of websites online where you can learn, and with apps where you can learn so many things, so many things.
Hmm.
And so I know we dealt with the issue of fake news and the effect it can have on the psyche. But somebody wrote a comment, and she says, I'm reading what she says. She says, a lady told me her daughter started crying and wheezing after she saw CNN one day. She was so
Mm.
scared and didn't know what to do. What would you have said to this lady and others like her? Because her daughter went into panic mode when she heard, because this thing is coming to get us. Everybody's frightened. So what do you say to her when she has a child, you know?
Her daughter needs a hug. She definitely needs a hug, and hugs are not prohibited in at home.
Among family members, eh?
Among
Among
family
those in the same
members,
space.
they're not prohibited. So her daughter needs a hug.
Let's be
She
clear.
needs,
Let's be
and her
clear.
daughter. I don't know what the age of her daughter is, but as a daughter, you're never too big to be on your mother's lap, or to be sitting up close and personal and having a conversation. Maybe that's all she needs, some reassurance from the mother that, yes, this is happening. Yes, we all have to be careful. This is what we can do as a family to protect ourselves and realize that we do the best we can. And once we've done the best we can, we leave the rest to God.
Important that she continues to speak about the situation
Hmm.
to that daughter. With time, the
Let her
conflict
talk
will
about her
resolve.
fears. Be specific
Exactly.
about what she's scared about, Yeah.
The conflict will be
Yes.
resolved about care. And
Hmm.
subsequently, she should provide sufficient information so that
Hmm.
she can move forward. Again, to limit access to the scary news. If you read on the news today, 800 died, tomorrow 750 died, that may continue to take care, okay, the minds of such data. But definitely, as adults, should be able to discuss, give information adequately to help that data to resolve the fears on our mind.
Hmm.
All right, so we have reached the 1 hour mark, and I think we're over by 9 minutes. Any closing remarks, Dr. Banks, Mr. Bamashile?
Well,
Well, no, I like Dr. Bank
the,
to end.
basically, there are so many things that we can do to help ourselves. And one very important thing is that attitude of gratitude that we hear about so much. We can be grateful for what we have in spite of what we have lost. We can be grateful that we have so much that we can be thankful for. Make a habit of noticing the things that are going right in our lives, rather than dwelling on what's not right. Make a habit of being grateful for the friends we have, the friends and the family we have around us. And to know that, be kind to ourselves. Know that we too are under stress. So there are times when we might get a little irritated, you know. So notice that, give yourself some grace for that, and know that you're not perfect. You know, this is not a time that any of us expected. So our reaction will never be perfect, but we will strive to do the best we can. And we'll also exercise that grace to those among us, knowing that they are all coping with this in the best way that they can. We're all in this together, and we will all come out of this better people with a greater appreciation for life, a greater appreciation for what we have, a greater appreciation for relationships. So let us focus on what's the good that's going to come out of COVID-19, and know that a lot of good can come out of it as long as we give ourselves permission to work through our feelings and to appreciate that we have life and there is a lot of stuff that we can still be grateful for.
But one of the things while you're wrapping up, I would like us to talk about, we should not, I don't, what do you think, or how would you approach the issue of our faith and prayer in these really, really turbulent times? I know we live in a world that's becoming very largely secular, and people don't even want to talk, some people don't want to hear about prayer, but we know that it occupies a very important place in our lives, and most of us are grounded because of it. So what do you say to people? Because that is one of the ways you can keep anxiety from the pressure cooker lid from flying off.
Maybe I should quickly say that spirituality is one of the coping mechanisms. So we cannot throw away prayers. We can't throw that away. Prayers make us to have a strong faith. Prayers make us to have strong belief in God and stuff like that. So that I can put under spirituality. It's a way of coping with our situations in this present time. Dr. Banks already mentioned the issue of appreciating ourselves and, of course, creating value for ourselves in spite of our losses. Because I know there are quite a lot of people who would have lose family members. Some are physically lying down in the hospital. Looking beyond that, the situation we find ourselves, we can make better situation out of it. And it's just all about our continual thinking positive, hoping for the best. Let's turn off the channel of optimism rather than pessimism. Even when we all know that the death toll across the globe will still rise from what we have today. But appreciating what we have now, our values, our relationship with family members, and hoping that tomorrow we can come out strong after the post-COVID-19 would probably give every individual the strength to move forward, because we still need that strength. It is not yet over. It is not yet over. We need a lot of strength to continue to move forward.
But that is it. That is it. We cannot underestimate the importance of prayer and the switching off of negative channels. People still want to be feeding on nonsense. You know, even the channels on the television. I noticed that they have a lot of horror movies. They have a lot of movies with dark themes. This is a crucial time in the world. This is, and even Lent. But you still find that they have all of these things. So if people plug in, it's from one vampire, this and that, and these things stress people out already. It's already stressful as it is, having to, cope with the onslaught that may be coming, if at all is coming, whatever that may mean for some people.
Yes, one writer said, we are human beings. We are spiritual beings having a human experience. I think it was Louisa L. Hayes. And we are spiritual. That's what differentiates us from the other animals and stuff. We are spiritual, and we need to dive into that spirituality. We're not saying that someone must go to the church that we go to. We're not saying that they must worship the God that we worship, but we are saying that we are spiritual. That's what differentiates us from others. So we need to plug into that spirituality, and that will help us over any challenges that we face, because we know that there's a power, there's a higher power who can help us. So
And we
as
unashamed to do it, eh? Unashamed, because some people don't want to go to church, or what will they say? They think I'm so bad. Sometimes we ourselves can make life so hard for other people. So
Mhm.
let somebody get a little ease up by practicing their faith. That would, give them the strength they need to move forward.
Yes.
Because we're not really in control, eh? We are not. We feel like we know
No.
so much, but we're not.
And I think that COVID-19 has taught us that in a very dramatic way. The
Yeah.
uncertainty of it. We know that it's not in our hands.
Mhm.
And so we give it up to let go and let God, so to speak, knowing that we are doing the best we can, and we let God do the rest. God as we know him.
All right. So if we have no more questions from our listeners, and we've already given our final words, haven't we? Have we given our
Just
last words?
Well, I can say that use the prayer, the serenity prayer, which is very good for AA. God grant me, right? The serenity to accept the things I cannot change,
Exactly.
courage to change the things I can, and the wisdom to know the difference. I think that prayer is very applicable at this time. There are some things we can control, there are some things we cannot control, and we need to have the wisdom to know what that is. And then let go and let God.
Well, while I also back that up, I would like to encourage all listeners and those who will probably watch later to please speak out. There are certain situations we cannot help ourselves. So you can get help from counselors around you, professionals. When you think you're having mental health issues, please don't hesitate to speak to mental health professionals to assist you before you get out of hand. Because one of the outcomes of COVID-19 will be that an increase in mental health issues across the world. No doubt about that. We must prepare for that. And so to be able to curb so many millions presenting with mental health issues, we need to encourage individuals to speak out, even within the situation we find ourselves now, to seek help from the mental health professionals. Thank you very much.
So let me thank you.
One final note. Please be aware that at times like these, we kind of try to get engaged in things that make us feel better, which might be bad habits. Don't overeat. Don't overdrink. Don't over anything, because at these times, addictions can come into play. So just watch yourself, observe yourself, be kind to yourself, and do things which are self-affirming and things that will help us be better people after this period, by the grace of God.
Yes, yes, yes. Anyway, so I was just reading some of the comments that people were making on the chat. So let me just thank you again, Dr. Bang, such a lovely lady and so wise and so well experienced.
God is good.
Thank you for who you are.
Thank
Beautiful
you for giving
face.
us the opportunity.
Thank you very much. And Mr. Bashimili. Actually,
Bamishili.
Bamishili. I met him in
Thank you.
Montserrat
Thank
a couple
you.
months ago. I was at a function and he happened to be at my table. And there was something happening in that same Caribbean current chat. And I remember them asking a question. And I said, well, only a psychologist could answer it. And he was there. So he gave a response to it. And then after that, somehow we I don't even know how he came on the chat.
The rest
But
is history.
yes. We don't talk often, but I know he's on the chat, and we all
Yes.
come out to each other when we need one another.
Yes.
And we want other people to know on Caribbean Currents that there are experts in that chat room. If you need something asked, somebody will answer. People speak multiple languages, Spanish, French, and all of that. So anybody who wants to join can let us know, and we'll send them a link. So thank you again. Thank you very much. That was our first effort. And we want to thank Vaughn Hazel. Vaughn is such a darling, a saint. Vaughn has been so kind to us. This morning he went for the dry run with us, and he set it up and everything. And we really, really appreciate you, Vaughn, for what you've done for us. Thank you
He's
very
so
much. I know
patient.
he's in the background. He wouldn't answer because he doesn't want to be broadcasted. But we
So
want to thank
patiently guided us. He so patiently guided us through the whole process.
for the whole process, and it worked. We didn't know how it was going to work, but it did. So we want to thank God as well. We want to thank God for his hand in this. And hopefully, moving forward, we can give more information to people on various topics. As somebody is saying in the group, that perhaps that's the beginning of a series of perhaps discussions we can have via this medium that
So
we
much
can
good can come out of loss, eh?
a lot can come out of it. Yeah,
Yeah.
a lot can come out of it. So we thank God for this, and we're about to sign off now. And everybody have a pleasant night and a safe journey home. So you home,
Bye.
you home
Thank
already.
you.
Safe journey home,
Bye.
but you home already.
Blessings, everybody.
Yeah, man.
Yeah.
Thank you. Good night,
Thank
everybody.
you.
Good
Yes.
night. Bye.
Bye.